Welcome to Dr. Imran's official. Today we will discuss craniovertebral joints and craniovertebral angle. There are many types of vertebral joints, but the atlas and axis form the only craniovertebral joints in the body. A craniovertebral joint is exactly what it sounds like. A joint that permits movement between the vertebral column and the skull. The ligaments in the spine support and reinforce the joints between the vertebrae. The atlas and axis in particular work with the ligaments to move the neck. The atlas and the occipital bone form the atlanto-occipital joint, which allows neck flexion. When you nod your head as if to say, yes, that is neck flexion. The atlas and axis form the atlanto-axial joint, which allows head rotation. If you shake your head as if to say, no, that is head rotation. The atlanto-axial joint is a compound synovial joint. A synovial joint is a freely movable joint, differing from other types of joints due to the presence of synovial fluid, which lubricates the joint. Most of the main joints, hands, feet, and other regions in the appendicular skeleton, are synovial joints. It is also a pivot joint. A pivot joint is made by the end of one articulating bone rotating in a ring formed by another bone and its ligaments. Think of a metal washer twisting around a bolt. The dens articulates with the facet on the atlas, as well as the transverse ligament, and this articulation provides the head with approximately 50% of its movement. Craniovertebral angle is measured by taking two lateral photographs of the subject in a relaxed seated position without a back support. Spinous process of C7 and the tragus of ear are marked with a body marker. A horizontal line is drawn passing through C7 making a right angle with the vertical. Then, the angle between the line connecting C7 spinous process with the tragus of the ear and the horizontal line, is measured using e.g. goniometer.